But then, whatever your doctor, your specialist tells you to do, it's best to listen to your doctor. Okay, the two of you are going to come together with a partner to get the best decision for you. One thing you should know that breast cancer does not have any effect on the unborn child. That is, you can't transfer or transmit this breast cancer to your unborn child. And after delivery to your child will not get breast cancer because it's not like transferable. Let me put it that way. So breast cancer itself does not have much negative impact on the pregnancy, but it's the treatment that usually causes problem, and also how advanced you are in the breast cancer diagnosis. That's where usually the problem comes. Okay, so please, when you go to hospital, whatever you're told, please listen to save your life and hopefully save the life of your child as well. Now, if you decide to have an abortion, the abortion is not going to save you, or it's not going to stop the breast cancer. Okay, so you thinking that because of pregnancy and the breast cancer, let me abort to save my life. It really doesn't have any connection. Okay, you aborting, maybe you just want to abort because you can't combine the two stress together, fine, but it will not stop the breast cancer. Now, breastfeeding and this together. Well, breastfeeding, it's possible when you've had a surgery, maybe one breast is still there, so maybe you can't breastfeed. But when you're doing chemotherapy, radiation therapy, or hormonal, therapy, it's not advisable, because breastfeeding, you're going to transfer some of these chemicals through this milk to your child. So it's not advisable to breastfeed when you're going through this treatment so as to save your child's life. So I'd rather advise you just go in the artificial, way. Yeah. And then can you trying to prevent pregnancy during this period, this breast cancer period, because maybe you are young, so you want to have more kids. Yeah, it's quite understandable. Well, there are some chemicals that may, these contraceptive, like these pills, these hormones, may not really help. The best is usually to go for condom, because it's non-hormonal, so the condom is usually the best way to go. So you can talk to your doctor about how best to preserve your reproductive organs, or how best to preserve your fertility, so that it will not be impaired during this process. Okay, so I hope you've learned so much today. You've learned a new French word, yeah, and you've also learned how pregnancy affects, or its impact on breast cancer, or breast cancer's impact on pregnancy. And so just understand that you can get pregnant during, you can have a child whilst you have breast cancer, but it depends on the stage of the breast cancer. Yeah, so I hope you've learned something today, and I hope it's going to help you. So on Friday, we're going to talk about breast cancer and the treatment, and how the treatments impact or affect our sex life, either positive or negative. We're going to talk about that. So please, I entreat you to subscribe, and then leave your comments, questions, and everything. Leave it there so that we all get to learn from each other. And then click on the notification button so that whenever I, release a new video, anything, you'll be the first to know about it. So until Friday, stay safe and mwah.